Also coming up this half hour, we're going to talk about memory loss, forgetting your keys every now and then. No big deal. We've all done that, right? Well, if you or your loved one, though, is constantly having problems remembering things, then you need to stay tuned. There's a free seminar you might want to try and attend. Memory loss is difficult not only for the person who's experiencing it, but for their loved ones as well. But there is help out there. Dr. Adam McDermott is a neuropsychologist with Cornerstone Behavioral Medicine, and he joins us this morning to talk a little bit about neuropsychology and how neuropsychologic services can help people.
Yes, absolutely.
So tell us a little bit about neuropsychology.
So neuropsychology in general is the combination of neuroscience and psychology. And what we tend to do is to look at how brain behavior relationships occur, and from a clinical perspective, we mostly functionally measure people's thinking skills, and this can help determine diagnosis for providers like neurologists, determine prognosis, and then treatment planning and things like that.
So how does a person know that they really are having problems? I mean, you know, a lot of us lose our keys, or maybe there's a word on the tip of our tongue and we're trying to think of a name or something and we just can't seem to get it.
Right. And there are absolutely normal age-related things that we all tend to experience as we get older. And it's a good question. And the only way to really experience that is anytime that you're having any kind of subjective difficulties, whether it's a friend telling you, a family member, or yourself, is to get checked out. It's like anything else. If you're having any kind of physical complaint, go and see the provider that might be able to help you. So if you're having memory problems, the typical people to see would be someone like myself, a neuropsychologist, who can objectively and empirically say, hey, you know, yes, you are or you aren't having difficulties, and if you are, here's what to do about them. So it's to go and see the right people and just to get it checked out to see if things are actually happening.
And if people are watching this morning and you're saying, gosh, you know, he may be talking about me, or, you know, a loved one, they're in luck, because tonight you're holding a seminar, right?
Right. Tonight we are having a free presentation on literally when should you be worried about memory loss. And we're going to discuss a colleague of mine, Adriana Yon, and we'll be going over, you know, what are those normal age-related things that we all experience versus, you know, what might be pathological or abnormal, and when should I go and seek the services of someone to help me see if what I have going on is in fact something that we should be concerned about.
And then next month there's a screening that will be taking place.
Yes, so the Alzheimer's disease, and again, I'm using my compensatory strategies, or what I call it myself, cheat sheets.
Cheat sheets are good.
The Alzheimer's Foundation of America is sponsoring a free screening clinic, and that's going to be held through, in conjunction with Cornerstone Neurology and Cornerstone Behavioral Medicine on November 15th from 8 to 5. And it's going to be a very brief evaluation to see if there are any kind of red flags on whether or not you need to have more comprehensive evaluation done, maybe whether you need to see a neurologist and things like that. So that's going to be coming up, and I believe you're going to have to, you would want to make an appointment for that, just because I'm sure there's going to be a lot of people in the community who might want to just get peace of mind, or, you know, check that out.
But if you want to go tonight, it's from 6 to 7 there at Premier Place, and it is free, right?
Yes, it is complimentary admission. There will be refreshments, and it's sponsored by Brookdale Senior Living. A good associate of ours, Debbie Dalton, helped put this together, so we'll be going over and providing everyone with that kind of information.
Hey, thank you so much for being with us this morning.
Yeah, another big thing that I just want to say is that we are actually initiating a comprehensive clinic called the Cornerstone Memory and Aging Care Clinic, which is a comprehensive clinic putting together multiple disciplines, neurology, neuropsychology, that is going to provide integrated care, and it really fits with Cornerstone Healthcare's medical home model. So you can go and get all this care, and it's very value-based care in that it's going to help decrease costs with patients and the healthcare systems, so that you have that continuity of care. So once people decide, or if we find you're having these difficulties, this is a place that they can go for follow-up treatment, and it can be a focus really of
everything.
and people can kind of recycle on through.
Great.
So,
Thank you. Good to talk to you.
yes, pleasure to be here.